Hi, I'm Dr. Scholz. Let's talk about clinical trials for prostate cancer. Men who are considering a radical prostatectomy, who are in the Azure category, that's the high-risk category, PSA over 20, Gleason score 8, 9, 10, or perhaps a large tumor in the prostate itself, could consider taking a combination of surgery plus hormone therapy. This is a really interesting question. Historically, hormone therapy has been reserved only for men who are getting radiation. But long-term cure rates with high-risk prostate cancer with Azure using surgery have not been very good. And there are some studies. Tanya Dorf published a study in the Journal of Clinical Oncology about 5 years ago that showed about 90% disease-free survival rates when men with high-risk disease got Lupron for about a year. Lupron's another name for LHRH agonists. There's a bunch of other medicines too, such as Firmagon and Trelstar. But 12 months of such hormone therapy was effective in that study. So Janssen Pharmaceuticals is funding a trial in 1,500 men who have high-risk prostate cancer. Half of the men are going to get a Lupron-type drug in addition to the surgery. The other half are going to get Lupron plus Apalutamide or Erleada. Apalutamide is a recently approved medicine for advanced prostate cancer. It has a unique mode of hormonal blockade. It blocks the androgen receptor inside the cancer cell, and thus is more effective than traditional hormone blockades such as Lupron. It's a pill. 4 pills are taken once a day. It's well tolerated. It can induce all the similar problems that we see with low testosterone. There's also an incidence of some skin rashes. But the effectiveness is definitely proven, and the overall tolerability is acceptable. So the study's got an interesting design. The men are going to get 6 months of hormone treatment before the surgery. At the time of surgery, when the prostate's removed, they're going to be able to look and see how much shrinkage there was in the original tumor. In some cases, previous studies have shown that the tumors can disappear altogether. The hormone treatment then will be continued for an additional 6 months, for a total of 12 months. Then it'll be stopped, testosterone will recover, and comparisons will be made between the two groups, the group that got just 12 months of Lupron and the group that got 12 months of Lupron plus Apalutamide. Hopefully, they'll show improved cure rates, and if that's the case, then the men who got apalutamide will be leading the way towards a new way to treat prostate cancer going forward, at least in the men that decide to do surgery. So if this study is successful and does indeed show higher cure rates over time, cure rates as judged by less metastasis, less PSA relapses, then this type of treatment in all likelihood will become a standard approach for men with high-risk disease who are undergoing radical prostatectomy. So if you want to participate in this clinical trial, instructions are on the screen. There are multiple centers throughout the country, and the opportunity to participate should be easily accessible.